She will present prevention of obesity and type 2 diabetes in adolescents. Professor Inass.
Bismillah ar-Rahman ar-Rahim. To talk about prevention of obesity and type 2 diabetes in adolescents, we need hours. So I invite you to attend the session tomorrow for more details. Obesity is a global tsunami. Together with insulin resistance, it contributes to the heightened prevalence of prediabetes and type 2 diabetes. The etiology is multifactorial: unhealthy eating pattern, lack of physical activity, alteration in sleep pattern, some genetic factors, environmental, psychological, and physiological influences, and increasing screen time. All these factors have recently become important contributing factors to obesity. Once regarded as a concern affecting high-income countries, it's now widespread in low and middle-income countries and adversely affects disadvantaged population in all countries. Effective strategies for prevention or treating obesity is scarce, and collective efforts are required to reduce the incidence of both obesity and type 2 diabetes. While designing interventions, addressing socioeconomic disparities is essential. Those efforts deployed for low-income countries may not be suitable for high-income countries. And interventions include, I'm going to screen the topics for intervention, but for details, please, I invite you to attend tomorrow's session. First, to screen for obesity and type 2 diabetes in adolescents, and this is done in schools and in early college years. To screen for obesity, annual screening for obesity is recommended for all adolescents, measuring height and weight, and according to the charts or according to the body mass index. Then to screen for type 2 diabetes and pre-diabetes, and this is to be considered in those with overweight or obesity who have one or more risk factor according to ADA 2025. A dietary recommendation for prevention of obesity and type 2 diabetes in adolescents, and we gradually work to change the family eating habits and lifestyle rather than focusing on the weight, and to advise parents to be role models for their children and adolescents. Exercise recommendations, and we appreciate the beneficial role of exercise in prevention of obesity and type 2 diabetes. The community-based prevention programs, and we start with social and conventional media recommendations, and social media is important for young adults and adolescents, while conventional media may be suitable for parents and caregivers. Community campaigns and initiatives, and let me invite you again for tomorrow's session for more details, because this is very important effort done in prevention program. Initiatives for policy makers level, Professor Peter was talking about the soft drink and the low-calorie soft drink and the use of sugar substitutes. This is very important, and also to prevent the power drinks for those underage, and also putting some high taxes on soda drinks to limit their use, to advise policy makers and MOH to do a clear labeling on caloric contents and micro and macronutrients label on each food item for the consumer to read before using these items. Mobile applications and modern technology, and I'm going to give a few slides about it, and then recommendations for pharmacotherapy and bariatric surgery in obesity or overweight for selected adolescents, and this is going to be explained tomorrow. And now I'm going to talk about role of application, artificial intelligence, and advanced technology in prevention of obesity and type 2 diabetes. Mobile applications with an educational component and feedback activity can be effective in reducing the attrition rate during lifestyle intervention for preventing type 2 diabetes. Mobile health, mHealth technology represents a promising tool as a support in clinical practice to empower lifestyle counseling, and these tools allow healthcare professionals to perform a multi-level approach targeting the whole family members. Applications are either dependent on data entry. The user can put his figures, his numbers, or can run fully by artificial intelligence. The applications start with introduction videos or narration guide, interactive sessions, or a simple game on how to ideally measure weight and height, weight in kilograms and height in centimeter, and to set up the personal information. For adolescents, we should gain the consent from the parents before using these applications, and the applicant should put his demographic or her demographic data as name, age, residence. These information are to be collected. Then weight, user can log his weight and body fat percentage, then to review the progress in the weight and in the body fat, and this can lead to more activation or motivation of the user. Waist circumference, and waist circumference is measured by centimeter using a flexible plastic tape, and body mass index to be calculated. Then dietary intake. The user can review his dietary consumption of calories and different macronutrients in order to be aware of the quantity and quality of the daily meals. He can log diet by 3 different ways, either taking a photo for his meal and through AI, this is going to be explained into the caloric content. And the other way is to search for food database, or to add by category to put the food portion and the type of meals, and then the AI again will calculate the content of this meal. And nutrition, either they enter their serving of fruit and vegetables, a number of water glasses and portion size of different types of food, or the artificial intelligence ran application using food-based computer vision image recognition. Both ways analyze the diet and provide a rating and feedback to the user. Exercise can log different types of exercise, either low, moderate, or high intensity exercise, and physical activity, either by manual entry of daily exercise or by artificial intelligence-based gesture recognition. Sedentary behavior, again, either logged by user as duration of screen time or sensed by AI when the user is static. Lab results, different types of labs, the patient can add them on the application, like hemoglobin A1C or other labs, and review them in order to be able to see the progression of his labs and the improvement, and to keep a good understanding of the current status. Any recommended laboratory data is put to the application, mainly LDL, total cholesterol, triglyceride, fasting plasma glucose, and glycated hemoglobin for those who are at risk or for pre-diabetic or for diabetic. And an alarm or a color indicator can show that certain measures or biochemical parameters are not within the normal range for age, and act as a goal setting per user. Modes. There are 18 types of modes and symptoms for the patient to select. The patient also can add notes in order to tell more things or to clarify different feelings or activities. The smart education is customizable, automated patient support program, continuous around the clock with education, guidance, reminders, encouragement, and users will receive messages and contents triggered by time or data analysis, allowing for more personalized engagement. Then we have to enhance the patient and to grow awareness and to alleviate healthcare professional burden, because the application will do most of the job. The data triggered weight, step counts, blood glucose or SMBG when needed, blood pressure, meal logs, and insulin dose if the patient is diabetic or if the person is diabetic, and user engagement. The type of contents that can be delivered to the patient, either articles, videos, questionnaire forms, links to external websites, setting goals with the app, data logging, and summary reports. The program task list to keep users engaged. To put a quick view of to-dos, what the patient should do, and to view the tasks by week and day, and directly click on the to-do task, and then if the task is completed, the patient will report that this task is completed. Lifestyle intervention with a smartphone app, and if needed the CGM for people at high risk. This was a study done, and the conclusion, intervention with a smartphone and intermittently scan continuous glucose monitoring increased glycemic control accompanied by decreased carbohydrate intake and weight loss. Then the smartphone and the app and the AI are beneficial, and we need further trials to confirm whether these interventions can reduce the incidence of type 2 diabetes or not. The applications will provide a visual display on the dashboard to track the user's progress at certain time intervals. In recommended cases, one-to-one help is needed. For example, specific one-to-one interactive tailored advice, for example, from a health coach as a dietitian for specific dietary concern, a psychologist for stress management, a trainer for personalized workout tips. In pre-diabetes, the application will guide the user to contact a healthcare professional when the results are above the cutoff level. In case of high blood pressure, again, the alarm will be provided for the user to consult a healthcare professional, and some applications can enable adding comments or reporting a mood status to help to manage stresses and to provide the user with tips to manage the mood status or to raise the spirit. Then what can technology offer? They are digitally connected 24/7, better decision, care and support, and for better decision, gain insights from the data about diet, nutrition, and exercise. to empower better communication, to receive care, education, analysis, and bi-directional communication, and also the parental involvement or healthcare professional involvement. Thank you very much.
Thank you, Professor Inass, for